Hello, I'm Rupak Datta. Approximately 7 million older Americans are homebound. Homebound persons have multiple chronic conditions, functional impairments, and frequent hospitalizations. These factors predispose them to infection. There are many challenges to the diagnosis and treatment of infection in home care. Access to diagnostic testing is limited, and providers often rely on caregivers to report clinical changes. Consequently, antibiotic use may be widespread, and the harms of antibiotics are well established. Studies on antibiotic stewardship have lacked representation from homebound persons. Currently, it is unknown how often antibiotics are prescribed in home care and to what extent prescribing decisions adhere to standards of care for common clinical syndromes in older adults, such as urinary tract infection. The objective of this proposal is to evaluate antibiotic prescriptions in homebound persons using a national cohort of patients who receive home-based primary care within the Veterans Health Administration. This proposal has two aims. Aim 1 will compare the prevalence of antibiotic prescriptions among those with and without dementia. We hypothesize that the prevalence of antibiotic prescriptions will be greater in those with dementia. Among patients with a suspected UTI treated with an antibiotic, Aim 2 will compare the proportion of persons having an order for a urinalysis between those with and without dementia. We hypothesize that an order for a urinalysis will be less likely in those with dementia. Our study cohort will include older adults aged 65 years and above who received at least 2 home visits from a physician within a 1-year period. Follow-up for all cohort members will extend from the index home visit to the time of death or end of follow-up. We will use validated diagnosis codes to identify persons living with dementia. To identify the subset of patients with suspected UTI treated with an antibiotic, we will use the first prescription associated with the home visit with a diagnosis code for UTI. We will use administrative data that include pharmacy, microbiology, and clinical data. Consistent with prior work, prescriptions will be restricted to oral agents from pre-specified classes that are prescribed within 7 days of an eligible visit. Eligible visits will be defined as face-to-face or phone visits from a provider who is licensed to prescribe antibiotics. The primary outcome for Aim 1 will be the annual prevalence of antibiotic prescriptions. The primary outcome for Aim 2 will be the proportion of patients that have an order for a urinalysis. Independent variables will include age, sex, race, comorbidities, HPPC program, and geographic region as represented by the Veterans Integrated Service Network. A multi-level modeling framework will be used as a uniform analytic approach. This approach is advantageous in the analysis of structured, grouped data. To promote health equity, results will be reported by race. Thus far, we identified 73,410 patients who met our inclusion criteria. Approximately 70% were above 80 years of age, and there was substantial heterogeneity with respect to race and region. 2/3 died during follow-up. Overall, nearly 47,000 patients were identified with dementia, and of these, approximately 41% received a total of nearly 67,000 distinct prescriptions during follow-up. Notably, 37% of prescriptions were associated with a phone visit. This work will be conducted at the VA Connecticut Healthcare System with support from the Yale School of Medicine, including the Yale Pepper Center. I will have an outstanding team of mentors, including Dr. Freed, my primary mentor who has expertise in geriatrics and clinical decision-making. Dr. Allure will provide expertise in statistics and clinical trials. And Dr. Dembry is a former SHE president who will provide expertise in infectious disease. $20,000 is requested to support a data manager. Data from this proposal will support a pilot study of an antibiotic stewardship intervention based on peer-to-peer comparison. This pilot study will be the focus of my own Career Development Award and designed to support a future pragmatic clinical trial involving HPPC programs as the unit of analysis. Thank you, and I look forward to seeing you at SHE.